Once upon a time at one of the international conferences in Barcelona, there are usually interesting exhibitions and new devices are exhibited, and a basic version of a specific device was demonstrated, which will provide highly precise measurements of eye movement based on the position of the eyeball. It was a construction that was so bulky and heavy that it had to be worn on a person's head. There you see cameras from all sides, and they should monitor the eye and so on. This idea seemed very correct and necessary to me, most importantly.
In our practice, we widely use a device called Gazelab, which was developed in collaboration with our Spanish colleagues from Barcelona. Together with Igor Ilyich, this device has been improved.
We were able to successfully create a portable, extremely beautiful, and incredibly elegant device, which additionally provides information regarding a massive computing center. He provides details about each of the eye movements. He provides information pertaining to where the eyes move faster and the locations where they move slower, essential especially when choosing which operation to perform, all calculations related to operations. I think the appearance of this device has revolutionized the approach to selecting the operation type and calculating it correctly in general. Furthermore, this is also a highly significant promotion in diagnostic matters of great importance.
We understand that in pediatric practice, determining the angle of strabismus is a leading, important, significant factor in surgical planning. And it is precisely for this purpose that an accurate determination of the angle is necessary. The Gazelab device allows to accurately determine the angle of strabismus, regardless of the patient's visual acuity, regardless of the patient's age, regardless of the magnitude of the angle of strabismus, the presence or absence of eye oscillatory movements, without any subjective reasons, and then plan the surgery. In addition, what is the uniqueness of this device? When planning surgery for nystagmus, it is very important for us to accurately determine the point at which the patient's nystagmus is blocked. That is, it is a certain point of nystagmus blocking. Its presence is associated with the fact that this point has the maximum visual acuity and minimal eye movements. And in fact, it is not a nystagmus. It allows us to accurately determine the point of nystagmus blockade, which is also very important. Regrettably, our patients frequently experience a scenario where doctors inform them that nystagmus cannot be surgically treated. What, in our opinion, are the limitations on the indications for surgery related to? It is exactly the inability to determine exactly the angle of strabismus.
Went to one doctor, said one thing, went to another, said another thing, went to the third, said something else. Continuously, yes, as one sees one thing, the other sees another.
The Gazelab device allows us to accurately determine the point of nystagmus blockade. That is, the point at which the frequency and amplitude of oscillatory movements are minimal.
After the eye movement information is received by the computer, the program evaluates all possible deviations and generates a report. And already a doctor reviewing this protocol can accurately determine the violation this person has.
And this is extremely important and defining in the planning of nystagmus surgery.
We can no longer imagine our professional life without it because it is so convenient and informative from the point of view of our professional activities. We cherish, love, pamper him for 3 months, once we call the Spaniards to have them fix him for us. We desire to establish it as the standard for all clinics at present. It would be fantastic, naturally, it would be beneficial for numerous. But today, obviously, it is included in our standard. And without it, we already, when you get used to the good, quickly we have the only device in Russia, but we want to promote it further and expand its reach across the country. I believe he underwent a 2-year training which involved a substantial amount of material. Presently, we are able to wholeheartedly endorse it.